We're going to talk now about some drugs to treat the respiratory system. Now, ever have a cold? Ever have allergies? Yeah. Ever walk into a pharmacy and see this plethora, this whole aisle full of stuff? And you're like, I just want to feel better. And you start grabbing things. One says, for a stuffy nose, one says for a runny nose, headache, it's all these things. You're like, yes, I want it all. Well, let's rip these apart and really talk about what you're getting, okay? So here, antihistamines. We're going to start with antihistamine. As you see, there are 4 that I'm putting up here to compare and contrast. Antihistamine, decongestant, antitussive, and expectorant. The first one, antihistamine. This is most common. I'm sure everybody's heard about antihistamines, right? Anti, I'm against. What are you against? Histamine. This blocks histamine 1. This is runny, drippy, snotty, gooey, right? Eyes watering, sneezing all over the place, your nose is running. We've all had that. So it's to treat symptoms of allergies or cold. It blocks histamine 1. It dries up secretions. That's why you take an antihistamine, right? Okay, what are the side effects? Well, antihistamines are anticholinergic. Now, what that means is it blocks the acetylcholine action. So these are, it doesn't matter. If you've got an antihistamine, you have these side effects. Now, the original first antihistamines that came out, like Benadryl, wow, they really have these. Now, the newer ones that have come out over the years, you know, Claritin, all the others, oh my gosh, aren't there so many of them? They are a little bit better on the side effects, but they're still there. They'll tell you, this is a non-drowsy antihistamine. You still get a little drowsy, don't you? Because it's hard to get away from all of the true side effects. You know, you can breed tigers so their stripes aren't as bright. It's still a tiger. It still has some stripes. So that's kind of what I'm trying to allude to here. So anything that's anticholinergic, and there's hundreds of drugs that are anticholinergic, you will see them have these side effects. We call them the 4 great I can'ts. Okay? I can't see. That's because it slightly dilates your pupils. And therefore, it makes it difficult to be able to, for your pupils to quickly constrict and see in different situations. So I can't see. I can't pee. It causes urinary retention. So it's difficult to start your stream. Sometimes you get some urinary retention with that. So I can't see. I can't pee. In fact, some drugs that you will see are anticholinergic. They use them for the side effect of trying to cause some urinary retention. And by that, I'm talking about drugs that perhaps are to hold down bladder spasms. You know, gotta go right now. That kind of thing. So does this mean, Diane, that if I take Benadryl, I'm gonna have difficulty with peeing? You may not have difficulty with it, but it certainly can affect it, yes. I can't spit because it dries up secretions. You get cotton mouth, right? Get a dry mouth? Yes. So I can't see, I can't pee, I can't spit, and I can't, and you can read that right there. It causes constipation. Yes, taking Benadryl can cause constipation, and this is one of the reasons why they don't like the elderly taking Benadryl and such like. Okay, finally, tired with a capital T. Tired. When you take an antihistamine, do you not get sleepy and tired? Yes, in fact, lots of times they will have drugs with antihistamine in it for the reason of sleep. Just like this one here, ZzzQuil. What is ZzzQuil? It's Benadryl, diphenhydramine. ZzzQuil is Benadryl. It's an antihistamine, but are you taking it because you have a runny nose? No, you're taking it for sleep. This is an example of a drug taken for its side effect, okay? Also, it's in a lot of different things. For instance, this is acetaminophen, 500 milligrams, and diphenhydramine, 25 milligrams. So, this is simply a generic Tylenol with a little bit of Benadryl in it and used for sleep, not for allergy. So that's an example of taking a drug for the side effect of it. Nonetheless, its main reason for treatment is the symptoms of allergy or cold. Okay, it is an antihistamine, classified as an antihistamine. Blocks histamine 1, all the drippy, dries up secretions. Side effects, because it's an anticholinergic, you have the 4 great I cannots. I can't see, I can't pee, I can't spit, I can't shit, okay? And tired with a capital T. Examples, Benadryl, which is diphenhydramine, and then loratadine, which is Claritin. Those are the 2 examples I want you to know. That'll be on the test. Okay? You don't have to worry. Which ones do I have to know? I'm telling you. Okay, moving right along here. The second one I want to talk about are decongestants. Decongestants treat nasal congestion, not lungs. Nasal. It does nothing for this. It's this, okay? Nasal congestion. What is it? It's actually a vasoconstrictor. Vaso means blood vessel, veins, arteries. Constrictor, what does it mean to constrict? What does a boa constrictor do? Yes, it squeezes down. So this constricts your blood vessels. How does that relieve nasal congestion? I'm glad you asked. Because when you can't breathe through your nose and you're all plugged up and you're just miserable, what's really happening is those tissues up in here, up inside in your sinuses, are inflamed and engorged. The little blood vessels, the little tiny venules and arterioles and capillaries are swollen up. They're full of blood. And so that makes the tissues swell up, so you can't fit air through here. So when you take one of these, it constricts those tiny little blood vessels, squeezing them down so that there's more room, so the tissues aren't as inflamed and there's more room for air to fit through. That's how they work, okay? Decongestants. They're actually vasoconstrictors. Now I want you to think about this for a little bit. If you're taking this systemically, and remember we talked about local versus systemic. Local, it works right where you put it. It doesn't have to go throughout the whole body. Systemically, if you take a drug systemically, it's going to go throughout your entire body. So if I were to take orally, let's say, a decongestant, it's going to go throughout all my body, right? So is it only going to dilate the blood vessels in my nose? No. It's going to dilate all your blood vessels, constrict all your blood vessels. So it's going to constrict the blood vessels in your heart, in your arms. Do you see what I'm saying? So what would be a side effect? Increased blood pressure, hypertension, right? Increased heart rate, anxiety, lower appetite. Ever take a Sudafed? Can't sleep, can you? Feel kind of jittery, don't want to eat that much? There you go. It's a vasoconstrictor. So folks with high blood pressure, watch it. Watch it if they're on one of these. And which is why we don't really like the elderly to take very many of these type of drugs, okay? Our examples are going to be Sudafed, which is pseudoephedrine, and then pseudoephedrine's little sister here. Now that this has been pretty watched after, pretty controlled because of, as you know, meth and so forth. This one is what you see a lot more of. This is the one you have to sign for at the pharmacy, and this is the one you can buy over the counter. Okay? So let's move on. The next one is an antitussive. I'm against. What are you against? Tussive, cough. Okay, Latin for to cough. So, what is this to treat? This is to treat a non-productive cough. It works in the brain. It works in the brain, in the cough center of the brain, and basically it's like a little Jedi in the brain saying, there is no cough here. There will be no coughing. It just suppresses the brain, that area of the brain, so you don't cough as much. Now, side effect is going to be sleepy, therefore falls. Anytime a drug causes your blood pressure to go too low, or for you to get sleepy, or if a side effect is dizziness, that is all code for be careful, they could fall. Communicate with your CNAs. Tell them this. Wouldn't you like it if somebody would have done this for you? So, let's talk about this a little bit. Why are antitussives used for non-productive coughs? What I mean by non-productive cough is like a dry hacking cough. I'm not talking about a wet cough where you're bringing things up. That we really don't want to suppress, right? Because we want them to bring that up and cough it out. But a dry hacking cough, we understand, and we do want to suppress that, especially so they can sleep. In fact, sometimes if they have a wet, productive cough, we will still give them an antitussive at night so that they can sleep, because that is so important, as you know. But mainly used for a non-productive, dry hacking cough, works in the brain, side effect is sleepy. Our examples are dextromethorphan. You'll see it as DM, as in Robitussin, DM. Now, Robitussin is just a brand name. You got to watch it because there's lots of different types of Robitussin. We're going to get to that in a minute. You can also have things like codeine and other narcotics that may be part of it that would suppress that area of the brain in the coughing center. Okay. Last one that I'm going to cover in this video is our expectorants. To expectorate is to bring up. So this is to treat a productive cough. We are trying to liquefy and loosen the mucus. You know the little green guy? Yep. We're trying to liquefy and loosen the mucus so it can be coughed up and out. What are the side effects? It decreases appetite, and it's very important that you give this person as much fluid as you can. It will not work if they do not have enough intake. Also, humidify the air. If they're on oxygen, just make sure their humidifier bottle is full and bubbling well. If not, perhaps try and get some humidity in the air. It's very important in order for them to expectorate, to cough up and out this mucus. Okay, the example, Mucinex. Who hasn't heard of Mucinex? They spend a lot in advertising, don't they? There's a lot of different, Mucinex is the brand name. And there's just straight guaifenesin, which is generic for Mucinex. And then they also can put several other ingredients in there. I'm going to take a look at that now. But guaifenesin is only lasts about 4 hours, so you have to take 3 or 4 times a day dosing. Mucinex is long acting. And so there you go. Let's look at some of the drugs now. All right, look at my poor worn out drugs here, folks. But this will still work. So I want to talk to you about all the various meds up here that we have talked about. And what is in different ones. Now this is kind of like a sample of what you might see if you were to go in our local pharmacy or drugstore and look at all these medications to treat colds and allergies. Sometimes there's 5, 6, 7 different active ingredients in one medication. And you really have to look at what you have. Not only that, there's other things we probably need to talk about. Here's an example of 2 different Mucinexes. Remember we just talked about the expectorant to cough it out? Notice that this is a 12-hour. Can you crush that? No, because it's giving you 3 doses in one tablet. If you crush it, they get it all at once, and then 6, 8 hours later, they'd be in bad shape again. So you don't crush these. If they have difficulty swallowing it, you need to get it in another form. It is made in liquid. Okay, now this one is simply guaifenesin, okay, and some DM. Remember what DM was? Yes, the cough suppressant. So this always tickles me. Cough it out. No, hold it down. Your body's probably very confused. But you can see that there are 2 different active ingredients in this. Now let's look at this Mucinex. Now this one says Mucinex Sinus Max. Okay, what's in here? You gotta look at the active ingredients, guys. You can always find that on the back. This has acetaminophen, which is generic for Tylenol, guaifenesin, which is your Mucinex, right? And then looky here, we have a decongestant, nasal decongestant. So you have 3 different active ingredients in this one. Okay. Let's look at these. This is Vicks, this is Alka-Seltzer, but what are their active ingredients? This has acetaminophen, this has aspirin. This has your decongestant, this has the same decongestant. This has the DM, this has the DM. So they're very, very similar on this side. And on this side, this has aspirin, this has acetaminophen. This has, okay, these 2 here are cough suppressants, and it has the same cough suppressant here. So just because they're different brands doesn't mean that they are different. Sometimes they're very similar, except this one has aspirin, this one has acetaminophen, which is Tylenol. So you can see, other than that, they're the same. You can also have situations where you have the same brand, but different total medications inside of it. Now, this is a generic Robitussin, and this has, as you can see, an expectorant, guaifenesin, in it, as does this. This is name brand, Robitussin. But just because it's Robitussin doesn't mean it's a cough suppressant, because as you see, guaifenesin, that is your expectorant. So you really have to read the labels. See what I'm saying? All right, here's some Sudafed. This is 12-hour. Would you be able to crush this? No. See, this is 120 milligrams in each one. That's like 2 or 3 doses together in one, so you wouldn't want to crush it. All right? Okay. This is just a straight out nasal decongestant. What's the side effect of this going to be? Remember, it's a vasoconstrictor, so what's it going to do to your blood pressure? It will probably raise it. Now, having said that, this is a vasoconstrictor. Which one would raise your blood pressure more? Yep, because it's systemic. This one is local. Will some of this eventually go systemic? Yes, but not as much and it works where you put it. It doesn't have to go throughout the system. Okay. Okay, so I think you guys are getting an idea of what I'm talking about. You absolutely need to read the boxes to see what is in there. You will find that actually there's probably only 8 or 10 basic drugs, but they can fill an entire aisle at Walmart, right? But it's really all just the same medications, just mixed and matched and pulled out and put in. And so it's important to look at this, because especially if you're working like home health or assisted living, families will bring this stuff in. And when families bring all these in, it's really hard to keep track of it. Let's say that you know Joe has a cold and he's been taking some meds for it. But what you don't know is that family also brought him in some ZQuil because he's not sleeping well. What do you think would be the effect of him taking the nighttime and this? Well, he's getting a cough suppressant and he's getting an antihistamine that both will make him very tired and dizzy, right? Sleepy. He could fall. He could easily fall. Combine that with having a cold or having bad allergies, and it could be a recipe for disaster. So these things you have to keep in your mind. You can't separate this and say, oh, well, that's sleep. It has nothing to do with this one that's for cold. Actually, they have some of the same ingredients, so you got to watch it. What's the difference between these two? Absolutely nothing. The only difference is this is weaker. This is more concentrated. What? Yes, it's true. And this is cheaper. Go figure. But this is cool purple color and the bottle is pretty neat. I mean, that is what you're paying for. Okay. Well, I hope this helped you get through our 4 main over-the-counter, for the most part. A couple of them might be things you have to sign for or need a prescription for, but a lot of these are over-the-counter cold and allergy medications. And knowing the difference between each one of them, knowing the examples that I'm expecting you to know for your test, along with the side effects, I have put these in a nutshell, everything you need to know about these. If it's up here, you need to know it. And I'm also putting it in your reading material, so you'll have a copy of it. Thank you.